Tuesday reflection.
Yeah.
We're back. I'm Dr. Mandy.
And I'm Khabo.
And today we're going to reflect on our Teen Tuesday series.
Yes.
So, on Tuesdays, in our Instagram page, we usually just have a video and a little summary where we get teens to tell us what they think sexual and reproductive health is. So today is going to be our first segment where we're going to reflect on what the answers and the responses were regarding sexual and reproductive health.
Yeah. So what was the first question that we sent them?
So in our Teen Tuesday, we started off with having everyone introduce themselves.
Oh yes.
And then just tell us a bit about themselves, where they're from, and what their favorite color or subject or something like that. And we got us like quite interesting people.
Yeah, they were some people were very vocal, other people were very timid and shy.
Yeah.
But yeah, pretty cool teens if you ask me.
Yeah. And then our first question to them was, what do they think sexual and reproductive health is? So define sexual and reproductive health.
Yeah.
And how do you think they did?
To be quite honest, no shade to the teens. I mean, thank you for all your effort and all your answers. We really appreciate it because without you, we wouldn't have this.
Yeah.
But I did realize that there is a bit of a lack of knowledge about what exactly sexual and reproductive health is. I mean, they do know the basics, what sex is, and also just keeping your sexual parts clean. Those are the two main, I think, answers that we got that were kind of consistent with all of them. But yeah, what did you think?
Yo, it was actually funny. One of the teens said that, sexual and reproductive health is try stay away from drugs.
Oh yes.
So that it doesn't mess with your
with your
inner
parts.
And that's true.
Yeah.
They are things that can mess with your inner parts.
Yes.
So thank you for throwing that in. But like you said, Khabo, I think they did very well. Everyone, and in general, when you speak to people and you ask what sexual and reproductive health, people will automatically go to what is known and seen. It's looking after your genital area, making sure that you are healthy and you can have kids. And then, I mean, there's more to that than the definition that they gave. And I mean, you can look at the definition. We have a post that's just going to give what is the formal definition of what sexual and reproductive health is. But in terms of conversations and what teens put out there, I think this was an expected outcome.
Yeah, definitely it was expected. I mean, they definitely did say what it is, actually. They did. I mean, it's sexual and reproductive health, taking care of your organs, taking care of your sexual parts. So yeah. So I guess what I realize is that they should know more. I feel like they should know more.
Like what?
Especially like I don't know.
Because I think and maybe same applies even with people our age. Like when we say sexual and reproductive health, maybe we should break it down into two segments. Because I think there's sexual health and there's also reproductive health.
Yes.
And this also ties into when we ask them, what do they think sex is? Because people will say, I think sex is just like we know how to make a baby. And I mean, sex is more than that.
I think what I sort of expected them is, when they were describing sexual health is like, condomizing if you're going to be engaging in sex, knowing what a contraceptive is, knowing what the morning after pill is, knowing, just those things.
Give
like
detail.
Kind of give detail a bit. But I guess, they're shy, so maybe it is a little bit like, yo, dude, now I'm talking about condoms on such platforms.
That's
and I'm a
true.
teenager. Whoa. So yeah, I guess their answers were expected. You're right, actually.
But even overall, like, I like how you did that breakdown because it puts it into perspective. Because you are right, sexual health means that when you do engage in sexual intercourse, you have all the things necessary for it to be a healthy experience for you. And that also reaches further into other things. So are you in the mental state to say, I am ready to be engaging in sexual intercourse? Also, environmentally, is this a safe place to be having sex? Like, I mean, your environment makes a difference. Are you in a dingy school corner?
Are you in the bushes?
What's
behind
happening?
the quad? Like, where are you? Where are you doing these things?
Exactly. So that also, and do you feel safe when you're doing it? So that also plays a part in sexual health.
Yes.
And then more, I think it's also what you're saying, and this also ties in very well with reproductive health. That do you have access to condoms? Do you have access to contraceptive or family planning? Do you know where to get the morning after pill, like what you said? If anything were to happen, and even beyond that, I think one of the things that I didn't hear was, do we do partner testing?
True.
Yeah.
HIV testing,
Exactly.
knowing your
Do we
partner's
even ask
status. Exactly.
Yeah.
STIs as well. STDs.
Definitely.
There is somebody that did mention, STIs. I think it was, what's his name? The one that's related to you.
Chaba.
Yes. He did actually mention that, STIs, just making sure, like, you know what's going on down there. So, at least they did say that. But over and above, like, that is sexual and reproductive health. You need to know, first of all, what's going on with yourself down there. And also, if you're going to be engaging sexually with another human being, you need to know what's going on down there with them.
Yes.
Because sometimes what they have, it can come to you, and sometimes what you have can go to them.
Definitely.
So, and also just knowing your status, just for yourself and yourself. But even more so, it becomes even more imperative when you decide to engage in sexual relations. And then what do you have to say about reproductive health? Do you think the teens understood exactly what reproductive health is?
I think they skipped through that completely. And I think that's generically what they're also being taught at school, because the reproductive health system is like, you get the anatomy of the genitalia, they tell you how the egg moves from one point to another, sperm counts, you fall pregnant, blah blah blah. But in terms of, so what happens, how do you keep your reproductive system healthy? People skip over that, and even we do. At my grown age, I can't really tell you what is the best, maybe let's say, home remedy to help with period pains. Because that's also, I guess, for females, part of your reproductive cycle. So things like that, I think we skip through a lot. So I think a specific one that I recently heard was the effects of contraceptives on your reproductive system. So the exposure of the hormones continually for long periods of time, what effect do they actually have on your reproductive system and your entire body? So that's something we don't talk about, and I didn't expect the teens to be at that level. I would be very impressed if someone had brought it up.
True.
But I think those are things that they can learn about. Like it's an exciting topic to talk about.
I think they should, mainly because at some point, and probably soon, they're going to start to experiment with contraceptives or the morning after pill or whatever, and they should know the side effects from a young age so that they can make an informed decision.
Definitely.
Because I'm gonna speak for myself. When I started, I didn't really know what was going on.
You were just told to get.
I was just told to get. Well, I wasn't told. I decided myself.
All right.
But also, it started with to control my menstrual cycle, and then afterwards it became for other reasons. But I wasn't really sure what I was getting into, and it's only later on when I was older and I was actually in the health sector where I started to realize that actually, no, man, some things. What's cooking oil here? Something's not. But not that they're bad. No, I'm not saying contraceptives are bad, but I think you do have to be. You need to. What is it when you research on stuff? You need to have information before you start on the actual product that you'll be using, and do your research. That's what I wanted to say. Do your research before you decide to use things like that.
Yes, and it's not a one shoe fits size situation. Because different people respond differently to contraceptives. I've had patients who were on the pill and didn't like that, or were on the pill and were still seeing their period, or it made them have a heavier flow. Those who, at least, especially those who get depo, some of them don't like the fact that they don't see their period at all. Some of them have a heavier flow. Some who had an implant on just had non-stop flow, and then you have to adjust the contraceptive. So I mean, if you have information, then you know when you go to the clinic to say, okay, I was on this, I know this and that. But if you don't, then you're like, oh, so now I'm doomed. I don't have any other options.
True, and also with the information, like you know what to expect.
Yes.
Like once you start to experience these side effects and all that stuff, you're not like, oh my gosh, it's all going wrong. Like you know what to anticipate. So I think that's another reason why it's important for them to know.
Yeah.
From a young age.
I also had a relative of mine who were talking about contraceptive, and the one thing that I highlighted to her was, you know, that whole thing which is certain antibiotics affect the contraceptive's effectivity.
Yes.
So when you are on an antibiotic at a specific time, condoms as supplementary.
Yes.
It's just like, really? And all this time she'd been using antibiotics with her contraceptive and other things. But
was there a surprise?
There was a surprise.
Oh.
But bringing us to that surprise as well, I think one of the things the teens should also look into is, I realize there's a big gap in us finding places of safety when we do run into some trouble. Okay. And this is the trouble of conceiving when you didn't anticipate to conceive. So this is going back to morning after pill, abortion sites, and other things along that line. I think also, and recently I've been watching a show. I don't know if I should say the show, but I watched the show, a popular show. Okay. And the guy on the show, he got a girl pregnant. Okay. And she then was like, I'm keeping this child. And he was like, but why? Because we don't in a relationship anymore. Okay. But she was like, you can be as involved as you want to, but I feel I'm ready and I want to keep this child. Okay. I felt some type of way about that because I saw that for the guy, he didn't have the choice. That child, biologically or in carrier and legally, belongs to that mother, even if he contributed the sperm. Yes. So if she chooses not to abort, it's her choice. He can try go sue her, but I mean those have not been successful. True. So my point is, I'm trying to bring the two together. That from the female side, there's a lot of work that needs to be done for you, learning which abortion sites are available in your surroundings, if that's what you want to do. Plan B pills or morning after pill. Where do you get those? Do you have to go to only public clinics? Can you get them at discount? Can you get them? Can you get them at a private?
You can say anything. Okay,
can you get them at discount? Can you get them at any pharmacy? You know, something like that. And then from the guy's side, to also be aware of what are your legal rights when things like that happen to you. Like, what if you get a girl pregnant and you actually prefer that she aborts? What's your stance? Where you get, and maybe that's a more mature conversation and not necessarily for the teens, but that's decision making.
It is decision making, and you could find that at some point, I don't know, maybe it's not their plan to have children, but they might be in a situation where they need to be like, no, I don't want the child, and whatever, and they need to know their rights. The female also needs to know, in case she, falls pregnant, where do I go? Like, who do I speak to in terms of, terminating and all of that. So, and the morning after pill, like you said. So, yeah, basically, these are all the things that we feel teenagers should at least have some kind of knowledge on, because these are situations that do face them. I mean, we all know that teenagers is when people start to generally start exploring when it comes to sexual intercourse, and if you're going to be engaging in sexual intercourse, there is a risk of pregnancy, STIs, STDs, and there's just a risk. Trauma as well. Your heartbreak as well.
There's a lot of I think that was a very good summary, and I think also what I really appreciated about the teens was also the mature response to a lot of these things. Yeah. I mean, as a teenager, at some point you stop giggling about sex because it surrounds you. And it's not to say you need to engage in sex when you're not ready for it, but it is good for you to be informed and to know. Yes.
Knowledge is power.
It's absolute power. I mean, it really is power. So I was so impressed at how, they carried themselves. They may not have given like responses that,
At
you know,
all.
like, this is a
Yeah,
fact, I think,
you're
X, Y,
right.
Z. And I mean,
You're right.
that's fine. But I was so proud of them for, you know, this is what it is, this is what I know. And we even had one of the teens who was like, I'm actually not interested, but you know, I had plenty of time to learn. And I mean, that's perfect.
Good. That's good.
That is, as long as you have a definition.
Yes.
Yeah.
Yes. And she's willing to learn. When she feels like she is ready, she is going to do her research, which is good.
It is great. It is great. And I think then we achieved the goal of us asking them.
Yeah.
Because I think for me, above and beyond, when you don't have a stance on anything, or when you don't, you know, sort of ascribe to some sort of center where you refer to your pool of knowledge, then you are a risk and a hazard to society.
Yes.
So it's good for young people to have a stance. It's good for young people to know how to define things for themselves and know when things are right and when things are wrong. And also have information on what do they do when they feel like things have not gone in a way that they would prefer. Because this is a right. Sexual and reproductive health is a right. Yeah. So I think we succeeded on that front. Everyone, or the government and basic education also has done that. and parents.
It's the way you said that for me. But yes, they have done well. Parents, you've done well.
Yeah.
Your kids definitely are educated on the basics of sexual and reproductive health, which I think is good.
Yeah.
Can be better.
It can be, and that's why we have Bushanani.
Yes. But it's good. It's good. So yeah, that's all. Thank you to all our teams. Shout out to you guys. You've been amazing. And that concludes our video for today. Teen Tuesday.
Tuesday.